This episode of Us and Them is supported with a grant from the Claude Worthington Benedum Foundation.
Hey, it's Trey Kay, and from West Virginia Public Broadcasting and PRX, you're listening to Us and Them. We're the show that tells the stories about the things that divide Americans. You know that saying, how the only sure things in life are death and taxes? I think we might want to add old age to that list. Each year, elderly Americans make up more of the population. Today, 16% of us are 65 or older. And that's expected to double as the youngest baby boomers move into old age. The future rate of growth of the elderly population in the U.S. will far outpace that of younger Americans in the coming decades. In West Virginia, that future is now. About 21% of the state's population is over 65. West Virginia ranks as the third oldest state in the country, just behind Maine and Florida. At the same time, West Virginia's birth rate is low. That's in part because young people are leaving the state and starting their families elsewhere. Since 2010, the Mountain State has lost nearly 50,000 residents. And from 2010 to 2018, it was one of only two states with more deaths than births. That generational imbalance is expected to grow even wider in the coming years. Where will this trend lead? And what kind of impact will it have on the economic, political, and cultural fabric of West Virginia? I think about this as I watch my friends help their aging parents. I wonder who's going to take care of the older generation, or Mama and Pawpaw, as we call them in West Virginia, when they can't be on their own. A shrinking generation of young West Virginians means fewer family caretakers to help out. That means many seniors rely on Medicare and Medicaid. These essential state and federal programs are funded in part by consumer spending and the income and sales taxes from a dwindling workforce. The caregiver crisis has been brewing for years. It's a complex problem without a simple solution. My generation, which, by the way, is at the tail end of the baby boomers, is now parenting our children and assisting our aging parents, who may live far away. My dad died 16 years ago, and my mom is part of the state's current cohort of elders. She's a healthy 82 years old and still living in the big 3-bedroom house in Charleston where she raised me and my siblings. At some point, she may need care. And I wonder if home care will work, or maybe she'll need to move.
Hi, Mom. Love you. Love you too.
I recently visited a friend in Minneapolis. Like me, she's sandwiched between her children and an elderly parent, her father, in West Virginia.
Can of fizzy water.
What do you call it if not fizzy water?
Seltzer.
Catherine Lewis is 56. She's an Episcopal priest who serves a congregation in the Minneapolis suburbs. Catherine grew up in Charleston, but left decades ago and has built a life in Minnesota. Her mother died 8 years ago after a long illness. But her 85-year-old father, Jim, still lives in Charleston. It's been hard lately for Catherine to support her dad from so far away.
Dad had a really serious medical episode in December, and none of the 3 daughters live in town.
Catherine called 911 from Minneapolis.
My sister-in-law, Michelle, went to let herself into his place and found him on the floor, and he had been down for a good number of hours.
So days before Christmas, when COVID was still raging, Catherine got on a plane to Charleston.
We learned that he had had a very serious seizure. We think that he was probably paralyzed. His recollection is that he was only down for about an hour, but it could have been 17 hours or something like that. So that was the emergency. Then he gets to the hospital, and there aren't beds, and there's no visiting, and he had to hang out in the emergency room for way too long. And with the seizure, not only was he suffering physically, one of the side effects was delirium. So it was really hard to engage him in conversation because he was not of right mind. He was delirious.
Her dad was having a dozen seizures an hour. He wasn't eating.
We thought he was dying. He thought he was dying. So we signed the papers for hospice and took him home, and my two sisters made plans to come. We readied his room for him, got a little Christmas tree. The neighbor loaned us some low lights. We decorated his room for Christmas and brought him home to die, is what we thought.
Boy, that was right. That was right on time. I'll tell you, you're right on time, man. Oh.
Well, not really. Hi, Dad.
Jim has mostly recovered.
We're just a few minutes.
When I visited Catherine in Minneapolis, it had been 5 months since his seizure.
You're 7 minutes
Catherine and I gave him a call.
Yes, I'm looking at my watch now. Yeah.
I'm blaming Trey. It's not my fault.
Well, all right. Yeah, well,
What's going on down there? What's going on down there today?
I've been on the phone with Express Scripts, straightening out my account and making sure I'm paying the right amount of money.
Catherine and Jim's check-in is lively. The two have a lot in common. Jim is a retired Episcopal priest. They talk about books, movies, and how hard it is for Jim to get around without a car. His seizures meant no more driving, and he couldn't live alone anymore. Catherine invited him to join her in Minneapolis, but he said no. So, reluctantly, he left the family home and moved into an assisted living apartment.
All right, Dad. Well, thanks for talking. I love you.
I love you, honey. And hey, Trey, I love you, buddy. Take care of yourself, please.
All right, thank you. Love you, Jim.
All righty. Bye-bye.
Bye-bye.
This is a major transition for Jim, and Catherine knows he's struggling with it.
It's not so simple as, did he want to move or did we want him to move? It's more like we're tied to each other. And so there's the complexity of any human relationships of trying to weigh out all the facets of that to try to get to the best decision. So it's easy to kind of jump to the conclusion that one person, is calling the shots. It's really like this dance of how do we figure this out together?
Catherine's dad is a close friend of mine. I mean, really, he's like family. When I got back to Charleston from Minneapolis, I checked in on him at his new place.
Good morning. How are you?
Jim's apartment is in a very nice senior living center that gives him care options as he ages. He's actually a little embarrassed to be living here.
This is a very big change. Moving from living downtown, people from all backgrounds, I mean, really, I love that. And this is an isolation from that. First off, it's all older people. My life has been full of a mix of people, politically, age-wise, color, and that's not what's here. So the decision was made not just for me, but for my daughters. So I had to really agree to all of this. But I knew that I couldn't have them living somewhere else and worrying about me like this.
The new apartment is up on a hill. a ways away from Jim's old neighborhood where he spent decades as a priest and political activist.
All of this is about loss. It's about grief. Every time we give up something, you might not call it grief, but you're losing something. And there are feelings that go with that. It's its own form of grief. We don't have grief only when someone in our life dies. I certainly have had that. But whenever a way of life that we've been living, we have to make a shift out of that. We're losing something, we're gaining something, but at the same time, it's a disconnect.
Despite a difficult transition, Jim is keenly aware of how fortunate he is.
There are a lot of people my age that don't have this option. They haven't been able to put aside some money. The government is talking about cutting all kinds of stuff that will affect them, poor people. That needs to be looked at and tended to. Politically, what's happened to these people? We just throw them away? By the way, these are people who mined coal that helped save us through World War II. These are people who did what is essential work. So we need to wake up to the fact that there are some people who have been discarded by the economy. And what do? Just let them drift off? So where are we going to see them? In an emergency room where they don't have any money? As a society, as a country, how can we rise up to meet those challenges?
Jim, it's so good to see you and spend time with you, and I hope this is not our last time, because I don't think it was.
Well, I hope it's not our last visit, but I do think that, seriously, we probably ought to approach every moment and every day as if it were our last moment.
I agree with you. I don't think there's smarter or wiser words.
For the past year, the pandemic added another challenge for seniors and those who care for them. In 2020, as COVID began to spread, the virus took hold rapidly in places where people live closely together. Nursing homes were hit hard. Through March of this year, 686 residents in West Virginia's long-term care facilities died from COVID. That's 20% of the state's total COVID deaths. No matter where seniors live, adults over 50 are the most vulnerable to COVID. Before the vaccine, 95% of COVID-19 deaths in the U.S. were people 50 or older. And 8 out of 10 COVID deaths were adults 65 and up. Even as the threat of COVID diminishes, as we age, we experience more illness and disability. It's estimated that more than half of people turning 65 will need long-term care, and that's a lot of people. The Census Bureau says 10,000 baby boomers will turn 65 every day. About half of West Virginia's elderly residents have some kind of disability, like hearing or vision difficulty, or trouble walking, dressing, bathing, or doing errands.
It's not just we're older and poorer and sicker, all of it together.
Jack Rogers is board president of Kanawha Valley Senior Services in West Virginia. He's also a retired public defender and legislative lawyer. I've known Jack for years, and I was really grateful that he made time to explain such a complicated topic. We started out with the basics. How is West Virginia meeting the needs of its growing senior population?
I'd say we're not. We're close. Federal money, primarily, Medicare, Medicaid. Then you've got a lot of different programs that actually date to the 60s under the Old Age Act in 1965. One of those poverty-type programs from that era that come into agencies like the one I'm privileged to serve. And those have very specific functions. A lot of it has to do with feeding people. A lot of it has to do with in-home health care in a limited way. It's not really a full-scale in-home health care effort, but it is some care that goes into your home, tries to keep you in place, cleans up the dishes, runs a sweeper, all those kind of things. A little bit of home health care, but not really much. We can't afford it. But it's those kind of programs dating from the 60s and then added to the Medicare and Medicaid and Social Security that basically are holding the state together in terms of the older population.
Jack's assessment of care quickly and logically heads to the cost. It's staggering. One statistic I found pretty astonishing. In 2018, Americans paid $61 billion out of pocket for long-term care services. That includes in-home and facility-based care like skilled nursing centers. Those costs are only going up. And none of us are immune. My good health today statistically doesn't guarantee disease-free or disability-free aging. In fact, the U.S. Department of Health and Human Services estimates that 1 in 7 adults will have at least one disability for more than 5 years. Federal data show each American turning 65 today will need long-term care that costs on average $138,000. While private insurance and public programs should cover about half of that, the other half patients pay for themselves out of pocket. That's about $70,000. And that's the minimum experts say we should all be saving. But at least half of older Americans living alone don't have that kind of money. And this is especially the case in West Virginia. Jack Rogers with Kanawha County Senior Services says the bottom line is that elderly West Virginians can't afford the care they'll need. That's particularly true for women. West Virginia women 85 and older outnumber the state's men 2 to 1.
When you look at this state, we are not only old and sick and poorly educated and fat and all the rest of it, but we got a bunch of people that just can't help themselves, and many of them are elderly. And particularly where you've got Medicare and Medicaid recipients, there are huge gaps of things they need. When you're 85 years old and you didn't work and you don't have a pension, your husband died 30 years ago, you're on Social Security and nothing else, you need help. And we got a lot of those kind of people.
And at least half of them will need some form of long-term care. And that's why federal and state programs like Medicare and Medicaid are critical.
When people talk about socialized medicine, we're socialized. We've been there a long time ago. The people that vote for Ronald Reagan and now vote for Donald Trump don't realize that, but we've been socialized medicine probably since the early 80s. And it just keeps getting worse as individual employers don't offer those kind of programs. Small employers can't afford it. It's gotten too expensive.
While public programs help a great deal, they don't cover all the costs. Jack says county-based senior service organizations exist to help fill in the gaps. County-based agencies are designed to help older people stay in their homes and communities. The goal is to provide long-term care services at home for as long as possible. That means less time in expensive full-time facilities.
Now that's a tricky thing. At what point does that become necessary? That becomes medical judgment. But for the most part, it's very clear, and the data is pretty much in on research, that if you can stay in your home reasonably well, you're going to be better off, you're going to be healthier. Question is, how much help can you get to make that happen? And that's problematic. It's a constant struggle, frankly.
Coming up after a break, home health care workers in West Virginia are busy as more seniors spend more years living at home.
I've got my prosthetic leg in December, and everything been going fine. I've been going around here, doing stuff. They've been teaching me how to go to the bathroom, how to dress myself, when I was in the hospital and therapy and stuff. So I'm doing fine. I'm doing fine. Going out, going to church.
But the home care industry can't find enough workers in the state to meet the overwhelming need.
we're feeling that in a very acute way right now, where we just don't have enough people to provide the care that is needed to allow these people to remain in place and age at home. We don't have enough people, and then some of the people we do, this is not necessarily the profession that they want to get into. Granted, this is not something that pays a lot of money, but it comes from the heart.
That's after a break. You're listening to Us and Them. This program is supported in part by the West Virginia Humanities Council and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
Hey, it's Trey, and this is Us and Them from West Virginia Public Broadcasting and PRX. West Virginia's elderly population is big and continues to grow. Just like the rest of the nation, the state is experiencing a gray tsunami as baby boomers retire. About 21% of the small state's population is over 65. West Virginia already ranks top in the country for obesity, heart disease, and mental health issues. These chronic conditions can complicate aging. Despite the health concerns that face so many elderly West Virginians, there are few doctors in the state specializing in geriatrics. That's the branch of medicine focused on the quality of life, care, and health of the elderly. Dr. Osvaldo Navia is one of only 10 board-certified geriatricians in the state.
We have so many people that they have 65 years old and look like 80 years old, or many 65 years old looking like 45 years old. I'm thinking is in terms of functionality. How do you feel in terms of your age, medical problems that you may have, and also all the challenges that your family is going to encounter if they're going to help you with your care.
Navia is Chief of Geriatrics, Palliative Medicine, and Hospice at West Virginia University Hospital. Navia was born in Bolivia and raised by his grandparents. He says he wants to help the West Virginia medical community step up its care for the elderly.
My mission here is to train residents, train clinicians, and also try to expand the geriatric philosophy in order to care in a better way our people more than 65 years old. My main goal is to train our own people in our own state to become geriatricians and also have a presence of geriatricians in different hospitals around the state.
Geriatrics connects the dots in a patient's care. Navia says that's important because most of his patients are managing about a dozen health concerns. Dementia and diseases of the heart and lungs are the most common. I asked the doctor when it's time to talk with a patient about higher levels of care.
I think there's so many reasons for this one. One of them is when you're becoming really sick and you are unable to take care of yourself. Let's say for long staying in the hospital and you are extremely weak and you need a lot of physical therapy or some kind of support to go back to your regular life and you fail.
Fail or fell?
You fail different kind of treatments.
I see.
And you realize that you really need help. Could be one of the main factors looking for long-term placement. Another factor that I can realize is when you have memory problems, when you have a diagnosis of dementia, and it's no longer safe for the patient to live by themselves, and they need supervision. It's another main factor to look for long-term placement. And the other thing that probably is going to be remarkable is when your partner dies. When your partner dies, it's something like probably you have some kind of balance living wife, husband, and somebody is going to die and you're going to be by yourself and probably you're going to need more support. And this is the time that placement could be an option.
But before that decision is made, Dr. Navia needs to help his patients and their families negotiate the healthcare system. As a geriatrician, he tries to bring together all their medical challenges and create a care plan.
We cannot send these patients to different specialists in order to take care of them. We are the kind of physicians who just try to put everything together, minimize the medical plan, and of course, we have a very active and proactive responsibility in the care of these patients.
Has medical technology simply allowed more and more people to outlive their bodies?
It's not just technology. It's the way that you are more educated in terms of taking care of yourself. It's accessibility to different kind of medications. It's new treatments that can change the trajectory of your disease. I think it's just a consequence, the way that we are living right now.
I'm thinking about that. I mean, it seems like while we're still kicking, it seems fine, but our bodies often are hobbled, they're impaired, our memories are limited. Is that something to look forward to? Is there a great quality of life when those parts of our bodies seem to be failing us?
I guess that's a personal question. I have patients that living longer is probably a priority. And they are not thinking about all the complexity, all the medical problems, medications. Their main goal is to live as long as they can. I have other patients that they tell me quality of life is the most important thing. I live to whatever years I need to live. I'm being able to do things by myself, make decisions by myself, take care of myself, live at home as long as I can.
Generally speaking, can you say what elderly people want from life?
According to my experience and my conversation with people more than 65, they want to be able to take care of themselves. I think that's the main priority for them. Be independent. They would like to keep the freedom and live at home as long as they can, of course.
In your opinion, is home-based care the best option for elderly people?
I think that's the best way to go. And I fully support families and patients that want to live at home. As long as you are able to do things by yourself, as long as you have the capacity to make decisions by yourself, as long as you are going to be able to feel safe at home and be safe at home, I think it's a great alternative.
As Dr. Navia mentioned, there is a point when aging in place at home doesn't work anymore. Typically, this is when chronic conditions, dementia, or injuries lead to hospitalizations and the need for acute care. When patients need more help, there are skilled care facilities. But the trend, even for those without resources who depend on Medicaid, is to come back home. That shift away from nursing homes has led to a rise in the home healthcare industry. Now, there is care to help with even the most basic tasks of life.
I get him up, I bathe him, I wash his hair, I dress him, undress him, get him ready for bed, and I help him get up off the bed of the morning and help him sit down on the commode and help him get up off the commode.
The growth in the senior services industry has created much-needed jobs for people like Eugene Barker.
Of course, he'll brush his teeth some, then I have to go back and, brush him a little bit more and make sure he gets them clean. I go out food shopping, I go pick his meds up, I take him to his doctor's appointments, all that.
I met up with Eugene at the home he shares with his longtime partner, 68-year-old Saunders Clegg. Over here, the TV is almost always on, in every room.
All right, well, you decide at home which one you're going to be, but don't go away. We'll be right back.
15 years ago, Saunders had a stroke. Eugene is his full-time caregiver. He works for a company called Right at Home.
A lot of people don't like doing this work.
Eugene is a certified nursing assistant with decades of experience working in nursing homes and other care jobs.
And then people say, "Oh, I don't know how you do it." I said, "I don't know." I said, "Reckon just the good Lord helps me do it because I do it, and I get tired. I don't say I don't get tired because I do, and it gets hard. But when I catch my time to get a little rest, I get it." Well, Saunders, I've been showing him your stuff on the bed and stuff. All your adventures and stuff. Yes.
Saunders can't speak, other than saying yes or no. The stroke also affected the right side of his body. Saunders loves superheroes.
So you like Spider-Man and the Mutant Ninja Turtles?
Oh, yeah.
You gonna get out and dance for him?
No.
Saunders and Eugene like to tease each other. They have a cozy home, but it's really hot in here. As Eugene talks with Saunders, he dabs his forehead to catch the sweat.
Tell him you like it hot. He's like his mama. She'd have it 99 degrees, they said, in the house.
Eugene tells me he's the only one Saunders wants care from.
Yeah. I asked him, I said, "Can I take a vacation?" He said, "No."
Really?
Yeah.
I mean, wow. I mean, that...
I haven't taken a day off or nothing in 15 years. I've been here, taking care of him.
You don't get these benefits automatically, so call now to see if you're eligible.
Did you take up the carpet?
Yeah, it was coming up, and then he was wetting on it too. And I took it up and put this down, had this put down.
I like that.
I saw that.
Yeah, that's a rug. It's not wood, it's a rug.
No.
Yeah, can't feel of it. It's a rug, it's not wood.
The day I visited Eugene and Saunders' house, there was a routine company evaluation.
I sign it because he can't sign it. I do it at the doctor too, so. Okay, you want me to date it?
I'll get it.
Yeah. Okay, right here. I put Petey, that's his nickname.
What is it?
Petey.
Petey's his nickname.
One more. Oops, sorry.
Don't get used to it, Saunders. I'm doing it for you this time. I try to learn him to write. But he likes to sleep now. Eat, sleep, and watch TV.
It's getting late. It's time for us to go.
Saunders, we're going to let you take care of business, and we'll see you next time.
It's in December.
Thank you, Saunders. It was very nice meeting you.
Well, you too. Well, come back again.
I will.
Well, you know I will.
As I catch a ride with Beth Thomas from Right at Home, I ask her about the cost of this kind of 24/7 care.
This is a Medicaid-funded program called Aged and Disabled Waiver. And it pays for, depending on their level of need, so many hours a month of care.
Now, in this case, Eugene lives with Saunders, and it's not as though he kind of goes away and then comes back. You know, that's where he lives.
Right. And we have some of those, but that's not the majority. The majority have caregivers that come in and then leave. But as you could see, Saunders could not be left alone.
Right.
So if it weren't for Eugene, he would probably be in a nursing facility.
Many companies are helping seniors age in place.
I saw there was an opportunity to do some things in geriatric care.
Eric Hicks is a franchise owner of Right at Home. He started up in 2005.
I looked at the demographics and I said, heck, there's going to be a growth in the number of elderly people coming down the pike as we move forward, and I'd like to figure out a way to try to capitalize on that.
Eric spent more than a decade in the industry and has tapped into what is now the preferred option for more and more seniors. The government and medical community are behind this model. Eric saw the shift toward in-home care in the mid-1990s as a way to hold down long-term costs.
The whole dynamics changed. It was driven basically by insurance companies because they wanted to get people to the lower cost setting, so it would cost them less money. And same thing for Medicare and everything else. They wanted to get people to a lower cost setting. Prior to the 90s, people might stay in a hospital many times for 2 or 3 weeks. Well, very seldom do you ever see somebody stay in a hospital for 2 or 3 weeks now. What they do is they'll go and have their whatever they need done at acute care center. As soon as they're stabilized and their vitals are okay, they're sent to a lower cost setting.
Dozens of home health care agencies in West Virginia serve an expanding base of elderly clients. Since Eric started up his company, it has become one of the largest agencies in the state. It serves clients in 8 counties, employs more than 400 caregivers, and 25 administrative staff. Still, Eric says West Virginia's home care industry is in a panic, trying to meet the overwhelming need of an aging population. As the state sees a historic increase in its elderly population, it's losing its younger workers. This is due in part to an ongoing exodus of young people from the state. And the future's not looking too bright either. From 2010 to 2018, there were more deaths than births in West Virginia. Eric calls this an acute situation.
We just don't have enough people to provide the care that is needed to allow these people to remain in place and age at home. We don't have enough people, and then some of the people we do, this is not necessarily the profession that they want to get into. Granted, this is not something that pays a lot of money, but it comes from the heart. And we are looking for people that really have a passion for caring and have a kind, caring attitude and want to help out other people in this capacity. And we just don't have enough people in our state to meet the demand for that, and we need to look at bringing in other people.
Actually, West Virginia has a history of that. Our mining industry brought people in from Europe, from various countries to come and staff the need. You're smiling as I'm saying that, but do you think that's something that maybe people in the state might have to consider?
Well, I think it's something we need to do, and not just consider. I think we need to make it happen. And I've compared it to your analogy just many times, is that early in the 1900s, late 1800s, we had many people that came here from Eastern Europe to work in our coal mines. They worked in coal camps in southern West Virginia, and then they branched off and did other things after that. We can do some of that with healthcare right now, where we don't have enough people to provide that care or want to do that work. We can bring in people who would welcome that. Now is the best time ever for people to actually listen to what I'm saying, because people understand that losing population is not a good thing, and I think people understand that we need to diversify. We've got to change the way we think here, and we've got to open our borders and be more inviting to different people people of different races, black and brown people, people from other countries. That's what's going to make us grow. That's how we're going to be diverse, and that's also going to make people want to live here, because people want diversity overall. And if we can make ourselves more accepting and open to that, I think that in and of itself will make people want to relocate or locate here. And now is the time for us to make that happen.
I think Eric makes a good point. West Virginia's got to build up its workforce. I do worry about the ripple effect of the state's worker shortage. I mean, the whole public health system relies on younger people feeding the state's budget with sales and income tax dollars. Actually, the state is already finding creative ways to pay for its senior programs. For example, the state lottery has become a primary source of revenue for the State Bureau of Senior Services budget and Medicaid program. Casino license fees also help pay for some of the Bureau's programs. One of those is the Lighthouse program. It's a small agency that pays some family members to provide home care for an elderly relative. Like so many support programs for seniors, it has a very long waiting list. President Joe Biden wants to spend $400 billion over the next 8 years to improve access to in-home and community-based care. That's part of his American Jobs Plan. Investments like that can help if Congress approves them, but there's still a critical worker shortage and long waiting lists. Americans collectively are already spending $400 billion a year on in-home care. That figure doesn't include the estimated 50 million people, 1 in 6 Americans, who provide unpaid care for a friend or family member. We all want assurance we'll get the care we need as we age. My cousin, Joe Monk, is 78 years old. He's a retired professor living in Amherst, Virginia. I sat down with him recently on the porch of his cabin in the Blue Ridge Mountains. I know one of Joe's passions is being there for family. And another thing he loves?
Pottery. It's been my life work pretty much. Jack of all trades, master of one.
Joe grew up in a multi-generational home. As a teenager, his elderly grandparents had rooms in his family's home until they passed away.
It's a 2-bedroom house, but it had a big basement, and so Grandpa was in one room, and the boys, I had a brother, boys were in another bedroom in the basement. There's an apartment in the basement. And Grandmother lived in a bedroom upstairs.
I mean, what was that like?
Well, I was a teenager, and it was just sort of, that's the way it was. I don't have anything to compare it to at that time. That's just the way we lived. My brother and I were busy doing brother things. It was just in meal times, they were all together and stuff. And maybe Grandmother had her own meal or something.
Was she in poor health?
She was in poor health.
Joe may have learned his caregiving skills from watching his mom. My Aunt Irene was an elementary school teacher, but she cared for her elderly parents as well as her husband. My Uncle Herman had polio. To me, all of this seemed like a lot to take on. But Joe says they didn't really talk about any of the hard parts. Decades later, when Joe's mom, Irene, needed a place to live, the answer was clear. Joe brought her home to live with his family. I remember visiting Aunt Irene at Joe's. She lived in a mobile home on his farm.
There was absolutely no thought of her moving into a nursing home or anything like that. No, it was just something you could do, so you did it. And we had young children, It's nice to have a grandmother to babysit or just to entertain the children, with whatever grandmothers do with grandchildren.
I don't know if you're familiar with Elizabeth Kubler-Ross and the book on death and dying. What I remember her talking about was, in some ways, that we as a society have in many ways kind of taken old people and kind of moved them off to the side, and that young people don't really get to experience this kind of final process of life. Do you feel like that in some ways was maybe kind of a positive experience that you gave to your daughters, to have their grandmother around and they actually could see her go through that final part of her life?
Well, Trey, you don't plan a life, you just live a life that just happens, and you're lucky if it happens in the right way for your situation. So that's kind of how that happened. These things just work out. And you just make the best decisions you can, and but it was a very positive thing. My youngest one that was born in 1981, so she would be 7 when my mother moved into the mobile home. She got a lot out of her. I mean, they were buddies. They did stuff together. Chatham talks about that a lot now, about her experience with the grandmother, the full-time grandmother. She'd go there after school, spend the evening. They'd watch TV, Lawrence Welk. They'd play games. They just did all those type of things. So there was a big impact on my daughter.
After Aunt Irene died and Joe's kids moved out, he and his wife, Sonny, invited her parents to come live with them.
We had room for them.
And I should say that all the folks lived long lives into their 90s.
Well, these are nice people, so they're not argumentative, or they're intelligent people, and they are interesting. They always got a nice story to tell about World War II. My wife's father was a navigator and making runs to the South Pacific from San Francisco. So there's always a war story. My wife's father, they were just sitting beside each other watching old movies on TV. And as people my age and their age, your TV's on, it's an opportunity to take a nap. So he just passed away from a heart attack sitting next to his wife watching TV.
Joe has been present for 5 in-home deaths, and I kept asking him, that's got to be a hardship, right?
Not really. I mean, how do you define hardship?
Well,
we're not that selfish as people to say that's a hardship. I mean, I just never looked at it that way. That's not really part of it, in my opinion. That's what you do for a fellow human being, you do what you can. And if I couldn't do it, I'd have to hire somebody to do it, but, I'm cheaper.
Do you have an opinion on how our society has, that there are definitely other options, that people could do something different than you've done? How do you feel about that?
Everybody have to make their own decision. If they want to be that selfish, where they just park an old person in a nursing home to dawdle away, that's they got to live with that. I'm not going to do that. I don't have a whole lot of insight on how society should operate. Just do what you can. Help the old people.
Joe has given me a lot to think about. Caregiving is complicated. And I wonder whether I could do what Joe has done, care for older family members and help them into their final years in the sustained, selfless, caring way that Joe has. To be brutally honest, I'm not sure that I could. And at the same time, I know that I would want someone to care for me if I needed it. So that seems selfish. knowing that I would want something that I'm not prepared to give. Home care is what everyone wants, but it takes time and effort and patience and love. My cousin Joe grew up very different from me. We're family, but his was a little more country and mine was a little more city. And maybe that's part of what defined how we cared for our elders. And maybe not. But even within my family, there's a difference in how we help our elders. And I realize that even more now after doing this story. We will all have needs as we age, physical needs to keep us going. But where will that help come from? From a family member? From a care facility? I don't know those answers. But now I do know I have a lot more questions about all of this. About aging and about being old and about needing help. And I know there are a lot of things that I need to learn. I'm not elderly yet, but if I'm lucky, I'll get there someday. And that's what makes all of us the us and them. We'll each have to deal with the issues of aging, and we'll all need some help. You've been listening to Us and Them. Our team for this episode is me, Trey Kay, Marisa Helms, and Kate Smith. Michael Lipton and Tristan Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.